I just want to welcome you back for fall 2018. Our whole team is really excited for students. We've been busy all summer with administrative work, and really our hearts and passion is for students and for teaching, and so we're really excited. I know you might not be as excited as we are, but we're ready for classes to begin. And if we're not, I guess you'll be the ones telling us what we need to do. But we have a little tribute this morning that we just wanted to share with you that talks about, what is nursing all about and the difference that each of you are going to make in your patients' lives as well as your peers. So.
For the average person, the demands are too high, the hours too tough, the problems too complex, and the pressure too intense. Maybe it's because the average person isn't wired the way nurses are. They stand apart with their willingness to make the sacrifice, to embrace their role in the bigger picture. They have the vision to see how each department, each doctor, each technician, and each nurse has to work in seamless harmony. And the ability to see the world through a patient's eyes. To look at a cancer patient who's worn down from chemo and know just the right thing to say to bring her back around. To talk to a child who's going into surgery and assure him everything is going to be all right. To push past the sore feet, the headaches, and the obstacles, and keep performing at a level that seems almost superhuman. Caregiver, problem solver, family counselor, friend. Not many people can do what you do, which leaves us only one more thing to say.
Good morning. My name is Kelly Lesk. I'm the Department Chair for Nursing here at Davenport, and I wanted to take a few moments to welcome you back today. Not many people can do what you do. You heard that in the video, and that's true. I don't know how many of you know that nursing school is the toughest, degree that you'll get. That's in statistics, so keep plugging away and reach for your dream. That's wonderful. I wanted to introduce to you Molly Bursley. Molly, if you'll just raise your hand. She is our nursing administrative assistant. So you may see her, you will see her in the nursing offices downstairs. She can be reached at 6154 or 7. We'll make sure you've got the right number. And she's there to help you with student badges. She's there to help you schedule meetings with us. If you need to get in touch with any of us, she's certainly there. She's the first person you'll see when you walk into our suite. So feel free to reach out to Molly. She's there to help. Additionally, you'll probably wonder why I'm wearing a green tie with this, blue dress, and it doesn't go together. But I'm here also to tell you that over the summer, faculty and leadership have been working very hard on new curriculum initiatives and things that you're going to see this fall and winter. And part of that is the reality that seniors in 427, which is community, are going to have the opportunity to go to Ireland and do a study abroad. So you may have heard a little bit about it, but I'm here really to promote it. Ireland will be wonderful. How many of our seniors are here? Who's our seniors? So yes, so it is open to all students registered in 427 at all 4 campuses. So we anticipate spots are going to fill fast. So Deb will tell you more about it today, but I just want to say, let's go green, right? And let's go to Ireland together. So thank you. I welcome you back. Have a wonderful fall.
All right. Our team wasn't expecting this, but I would like you guys to all come up and stand together. All right. I just want each of us to introduce ourselves, and I also want to just share kind of where your specialty is and how many years you've been a nurse. And I'll start with Julie because I think you got the most years on.
And I don't do well with a mic either. Julie Polanic. I have been a nurse since 1979. So most of you guys have not been. Most of you guys were not even born back then. I've actually been here at Davenport since 2015. And currently, in the fall, I will be doing OB Clinical. One of the OB sections, both of the PEDS sections, so some of you guys will have me for everything. And then in the winter, I will be teaching the sophomores health assessment and health assessment lab. And I am so excited about this year.
I'm Janine Blakesley. I've been a nurse since 2001. It was a second career for me. And I've been at Davenport since 2011. So I'm kind of with the juniors, right? So med-surg all the way. And then this year at this campus, we are piloting health promotions online. And they're all going, wah, wah. So we're excited about that. So we welcome you.
I'm Margaret Smith. I've been a nurse since 1994. This is going into my 22nd year in nursing academia. And in the fall, I will be doing fundamentals lab in addition to pharmacology and med-surg labs. And then the winter, in the past, I've done nursing capstone course along with evidence-based practice in addition to pharmacology. So just kind of a medley of different courses.
All right, Debbie Bosworth. A couple roles that I am here. I'm your Associate Department Chair for Grand Rapids. So if things are going on with student concerns or if there's some issues in the clinical, Shelley and I work very closely together. I have been a nurse for 26 years. It's kind of scary to say that because then I really do feel old. I am going down a different journey this year. This will be the first year I haven't taught OB clinical, and so I'm going to really miss that. I am going to be doing med-surg, the surgical piece, so you will have me for the juniors. And then I will also be teaching OB one session. Julie and I will do that together, and Julie and I have worked together for many years, so I see that would be great. The other thing in the winter, and Kelly kind of shared a little bit about that, is predominantly I do leadership clinical, and then I'm going to add a little flair of community in Ireland. And so it will be very exciting. We worked really hard over the summer to kind of make this all come to fruition. So take a deep breath, seniors. I think it's really happening. So.
And I'm Shelley Risenden. I have been a nurse since 1998. And so I did 18 years at Spectrum Health, and then I came here full-time. I love it. I am the lab coordinator and simulation coordinator, so I'm the one that's emailing you about all your health forms, so that would be me. If you have any questions, please come talk to me. It's much easier to explain them in person than it is through email back and forth. And I'm the one that kind of gets you set up in your clinical spots and make sure we have faculty there and gets all of your onboarding and all of that arranged for you. I am also doing a PEDS lab, I'm doing PEDS lab, and I'm also doing a PEDS clinical for the seniors. And I will probably be around a little bit with the sophomores in lab, kind of helping out and making sure everything is kind of set up and good to go for you guys in lab and med-surg as well.
All right, as you can see, we are a small team, but very mighty. We got a lot done during the summer, so thank you to each of the members of our team. So, I get the beauty of starting out with the student handbook, and it was kind of funny because Shelley and I were talking this morning, and she's like, you know, I'm not even on the agenda. I'm like, you get student handbook next year. So, let's pull that up. So, I am not going to bore you or anything like that. It's approximately 200 pages. It's my job, our team's job, to know the student handbook quite clearly. But there's some really important pieces, and we can go to grades. I want to cover a few of those things first. So one of the most important things to students is our grading scale. And as you can tell, we function a little bit differently than the other degrees in the college. So make sure that you see what your passing grade is going to be. So anything less than an 80% in the nursing program is a failing grade. So we need to see anywhere between 80 to 93%. All right. And then
Did you link this one?
Yes. All right. Patient safety. One of the biggest things, especially as a nurse and for our department, is we want you to be safe within the campus. And we do have a public safety here as well, and we do have security. They are on the lower level. Please, at any time that you are going to a class, a majority of our nursing classes are going to be during the day, but you might be taking your bios or your sciences at night. Please be in contact with security. If you're going to clinical, do not ever walk out of an evening clinical by yourself. Please, that's very important. Instructors will walk out with you. Ideally, we really don't walk out by ourselves either in a night clinical. We would have their security or some sort of safety officer walk with you.
Too far, sorry. That's even slower.
All right, let's just go to the,
There we go.
yeah, that's good. So when you go to your student handbook, approximately, let's see here.
Page. Yeah, it skipped a bunch.
Oh. Well, the new version of the student handbook on the website is different than how it prints out. So go ahead and move down. Let's go to
The introduction.
yeah, perfect. And then scroll down to the courses, like what the sequence
Okay.
is. Perfect, right there. All right, when we are grading you in the clinical arena, there are four common threads that we look at as far as what are you performing. Oh, you want to go back?
That was a practical nursing.
There we go. So we have the scope of practice. And that will be more about your ethical and accountability. And I guess I just really want to stop and take a moment to talk about some of the compliments that we received over the summer. Our team was pretty humbled by what we heard from one of our largest clinical agencies. Their career development team called us or emailed ours and said that by far, when they met with their leadership team, that Davenport students came out the most prepared graduate and ready to work. And so I just want to let you know that we have, without a doubt, believe that you're going to be the most competent and most prepared when you graduate from Davenport. And we work really hard on that. Seniors, we work hard. We work really hard this year. But you know what? You're going to talk to a couple of the graduates today for the panel, and they're going to share with you, how has that helped them be successful. So not only do they get to be most prepared, but they can be up and running quickly. care provision, communication. So when we talk about communication and we talk about setting events, which we talk about dealing with our patients, about 80% of Sentinel events happen for communication. So if you hear us saying, oh, this would be a better way to say this, or this is how we're going to say this, you know, like you've heard, we all have a lot of experience, and so communication with our patients is crucial. Management. We'll do a lot of management in senior year. In your junior year, you're going to be doing a lot of prioritization, sorry. All right. And let's go here.
Did I go
Just
past it?
Yeah, just up just a little bit. Perfect. All right. In education, students always have right, and there's a chain of command for you. If you're having problems with your instructor, we always encourage you to go to that instructor. If you feel like that's not a safe environment, please come to me. Let me know what's going on. A lot of times, you know, if I don't know what the problem is, I can't fix the problem. Many of you in the audience I have worked with very closely about situations. Those things are all confidential. And so if you do have any concerns, please just let us know. But you do have rights as far as students as, you know, your participation. If you have a family event, maybe there's a death in the family, an unexpected death in the family, please let us know so that we can have you be successful in your clinical or your classroom. All right, that is it. The highlights really for the student handbook.
Well, welcome again, everyone, to the start of the next academic semester. So I'm going to be reviewing some online forums that I'm sure probably the majority of you have had some contact with being at Davenport University in some way, shape, or form. So I'm going to be looking at first nursing news, and then we'll also be getting into Blackboard as well. So when we look at nursing news, what that is an online community literally set up for everyone at Davenport University, specifically for the nursing students. Not only is it for pre-licensure nursing students as yourself, but also for our practical nursing students and for our RN to BSN students. So it goes across all campuses, not only Grand Rapids, but also Lansing, Midland, as well as Warren. But its intent is just to keep nursing students that are in the program current as to what's the latest and greatest. So any items of interest, as well as what's going on in the profession, you'd be able to go to that source as well and find that information. After I just do a brief overview of the Blackboard, then we'll go through our little sneak peeks as to the key features of each of these online forums, just because I do have to log out here of the PowerPoint. So then Blackboard, as I said, I'm sure everyone has been in some way, shape, or form in this online forum, but it is a web-based learning management system used by the university, so ultimately set up and aligned with your assigned courses to just supplement and support them. I went to actually a little breakout session last week where they were looking to pilot a Blackboard Ultra, hopefully in the next year, and it has some key features, so hopefully those that are going to be here in their following years will be able to be introduced if this pilot goes live. But it's a nice setup to where you can actually see everything laid out in front of you, so you don't have to go in your individual course to see if there's messages, because all messages, assignments, you can just go to the Blackboard and everything's there that you would need, just in one location. So hopefully that pilot will go to fruition and become active. All right, so let me just log out here. So I'm going to go in specifically here just to, oh, not Janine's. Can I just change that out? Is that okay? All right, very good. All right. So when you go into these systems, first and foremost, you just want to log into your accounts. So I see we're updating. Firefox, so you can see this has not probably been used as frequently over the summer, but as soon as that uploads, hopefully, we'll be moving in. But you'll need to log into your account in order to access these forums. Okay, there we go. All right, so going into Blackboard icon, first with the nursing news, if you go under My Organizations, you're going to find this information specifically within the BSN online community. So it's labeled with both the practical and the pre-licensure BSN nursing students, but dubbed your nursing news. So once you gain access to that, so you'll have your home page right here displayed. There's also a calendar. If there is something more universal that would apply to all nursing students campus-wide, so for all 4 locations, that can be generated into this calendar and it would then propagate to all campus nursing students. Same thing for any announcements. If we want to post a universal announcement to all nursing students at all campuses, that can be set up through here. There's also a link for BSN nursing requirements, and it's set for each specific campus course, so you can see specifically here all the key forms that we want you to be familiarized with, as you are coming into the program on this campus. But it's the same alignment amongst all of our campuses. And then they also have specific groups. I know with the Grand Rapids group, we have the listings of all students based upon their level within the program, sophomore, junior, or senior. So there's even group setups that can be carried out as well amongst the individual campuses. There's also a link to Grand Rapids clinical site requirements. So when you go out to your clinicals, specifically if you're heading out to Mercy Health, St. Mary's, just as an example, if you click on this, we have essential paperwork that facility puts out to us for you as the students, so you can have information as it relates to what to expect going to that facility, any information as it relates to their systems for charting, Cerner or Epic. You'll have that information available under this link. So it's just a good source to know where to go to as essentially you make your way getting ready to go out to those clinical arenas. And then everyone will also need to know where to go to access your clinical paperwork that you will be completing for those rotations. So you'll see within this tab the breakdown of all the clinical courses. So fundamentals for our first year sophomore students going into this, you'll have all the paperwork that you would be exposed to within that clinical rotation. In addition, we also have your grading elements as it relates to your anecdotals as well as your summative and your midterm evaluations. So if you go back and you'll look, you pretty much see as we advance to your junior level, Med-Surg is the overlay of some of the paperwork, similar to what you saw. Differentiations may exist, for instance, with the health assessment forms, because as a sophomore, you're just kind of starting with basic health assessment, but then definitely having taken that course in your second portion of the sophomore year, you'll then be able to fully implement a complete head-to-toe assessment as you enter into your junior Med-Surg rotation. So, as I said, pretty much you see an overlay of certain documents that are used, but they are made more specific to the level of the program that you are within. And then moving into then your senior level courses, you have also a link here to documentation for your clinical paperwork for obstetrics as well as pediatrics. And being that these are more specified, more specific courses, you will see additional types of forms to be used within those clinical rotations. So this is a key area that you want to remember where to access this information, especially as your clinical instructors tell you to get those forms so that you can upload them onto your own software system and fill them out to complete for your clinicals. And then we have some additional tabs. As I mentioned, this also serves those that are continuing on to complete their bachelor's degree. And then there's also just a general discussion board. So for instance, I know in the past this has been used by a first-year nursing student just to know kind of what to expect in coming into the program. So individuals that have seen that discussion post have sometimes given ideas, especially now that they're at higher levels, junior or senior, just to give them some assistance in making it through that first year. And then there's also some tabs with resources. So we just have a variety of different things in here. I know we've really been putting emphasis, even in the previous academic year, on test-taking strategies. So you can find some tools as well under your resources that you can go to. And then also websites that we have available. Some of these may be a good resource that you can use to prepare and complete your coursework throughout your nursing program. Especially I know for our seniors, as they make their way into the second half of this academic year, it's going to be key to start to prepare for their licensure exam. So we have key resources here on how to apply for your license through the Michigan Board of Nursing, as well as for the application to take that licensure exam. So once again, this online forum is just a medley of different things that you will have to access throughout the time that you're in the program. Like I said, to get your clinical paperwork, or just if you have any questions or concerns, you can put those out to the broader community. And it's just nice that, you have it available so people can give you some insight or feedback if you have any questions or concerns. So do you have any questions yourself in regards to the nursing news? All right. Well, then I am going to move over to the next piece, which is looking at Blackboard. So I'm going to open up one of my shells that I have made available, and I'm going to actually put myself here into a student view, so you will see what you're getting from your end. But ultimately, you're going to see when that shell first opens up, there will be the Blackboard homepage. Literally every and each instructor's course, Blackboard is going to be individually and uniquely designed related to that course's background, as well as the included intent. So they're going to be set up a little differently. There's not going to be, the features of Blackboard are all the same that are within the online form itself, but then the instructors for the respective course will design it to meet their own needs. But you can see on this homepage, it'll identify the course, so the class, day, time, and location, where that will be. We'll also have our information for the instructors, so the name, their office location, phone number, campus, or they might include to have an additional phone number for contact. In addition to how they would prefer to be contacted through email, whether it be through the Blackboard itself or the university's email system, and then also their posted office hours. So I myself usually design that homepage to include those key components. So just keep in mind every individual instructor is unique and may set theirs up a little differently. So ultimately, just going down the left column here, some things that I personally put into my Blackboard shell, I always have an announcements tab. So anything that pertains to the course, maybe there is some change that's going to come up in the next week that I have to make the students aware of. So this is linked to your Davenport University email. So any announcement that's generated through Blackboard ultimately gets sent to you through your DU email for the respective course. But that's what the announcements are, just any updates pertaining to the course, it has to be addressed to the greater good of the students. There's also an assessments tab. This may be utilized in some of your classes. I've used it specifically in the past in preparation for giving a test to students. For instance, we have used in the past HESI, which is a software system where we test you on content specific to the course subject. And I've given practice tests through here, so you actually will go into the assessments tab, and I just did a little makeshift sample here of a math test, and you go right in and complete the test right within the forum itself. And then if you have any assignments that are required for the specific course, you would click onto that tab. Some may be set up as the template that you can just open up directly through Blackboard and specifically then type your information into that template, save it definitely through your own devices or flash drives, and then you can upload that then as a assignment to be placed in the Dropbox. And then going down discussions, I always have this available too, just if there is a question that a student has that relates specifically to the course. I always offer this as an opportunity for students to go in there and post any questions or concerns that they may have, or just for clarifying points as it relates maybe to the specific content of the day's discussion. So I do go in there periodically and check that, but even other classmates will sometimes go in and maybe even beat me to the punch and answer the student's question. But usually if one student has a question about a certain thing, there might be other students as well that have the same question. So it's a nice forum there to where we can just be very generic and just randomly post any questions or concerns or content clarification within that area. I know this is one link that all students are interested in, and that's your grades tab. So it'll keep you current and up to date on where your course grade is at the time you are checking it. Learning modules is going to be a very valuable area to go because it's usually where your course content will be week by week laid out for you. So you would go over into that tab and click on the information that you would require to have available for that course day's discussion. And then messages, this is going to be set up a little different depending upon each instructor, but I know specifically for my course, I love to use the course messages. It's a little different than the course email, which is a feature of Blackboard. Specifically with the course messages, this stays in the Blackboard. It does not go out to your Davenport email. And I do it because some of my courses, I do have people submit preliminary paperwork that I will review, and it just keeps everything within the course itself, and it's easier for communication purposes. But it's not hard to manipulate through this. Bless you. So you can click on Create Features. So go ultimately to, you would find the individual, that you're looking to send the email to, click it over to the recipients, and then of course add your subject, the body. The only one downfall to this is if you were looking to send more than one attachment, this does not permit that. So you can only do one upload, but then submit it off to myself. And every instructor has their own specific times of return response to your individual emails that are sent, but just keep an eye open. The only other downfall with this is I know you do have to go into the course to check the messages, but like I said, hopefully if that pilot goes through in the next year, that will offset that concern. And then lastly, syllabus. To that tab, it'll give you the course syllabus, so you'll be able to open up that and review it prior to coming to your first day of class and also reference it so you can see week by week what the schedule is for the semester. And then lastly, I put within my specific Blackboard shell just additional student resources, some of the more commonly used ones. So if you have used Blackboard but maybe not as often in some of your courses, or certain features within the Blackboard are newer to yourself because you've not had them in the past, there is a tab here for Blackboard Help that you can go to that will take, information. Maybe you don't know how to specifically or can't recall how to upload that assignment, so you can click on that tab and it'll run through steps on how to go through that process. Okay, so that's one specific feature there. And then the other thing that I post too is just a direct link to the library. So definitely there are resources available through here. Some are specifically set up with specific nursing classes. So if you're ever taking a specific nursing course that requires a lot of paper assignments, some of them have actually been set up as LibGuides through the library, so you can access that specific course's LibGuide to get information on that course's assignment. And then, of course, we never go without sometimes difficulty with our technologies, so you can go and access tech support as well, just to contact someone from our IT department. So any questions in regards to the Blackboard? And if you do have any questions in regards to either of these online forums, feel free to, ask myself, any of your other instructors, and we can definitely walk you through the process on how to get information from these resources. All right. Well, if there's no questions, I will turn the floor over to Julie.
Okay, I'm always the one that gets to talk about HIPAA, so it's always, for those of you guys who are a little bit older or seasoned students, you guys should know all about the HIPAA. But for those of you guys who might be sophomores who do not work in a medical facility, HIPAA might be a little bit newer to you. So this actually started back in the 1990s. And although we think that it's typically the confidentiality, it actually started out as the portability. So back then, if somebody had a pre-existing condition, moved to a different job, they were no longer insured. So this kind of started as being able to move your health insurance along with you wherever you went. Well, kind of along with this was the confidentiality aspect. And I think that's really the part that is first and foremost for us is making sure that all of our patients' health data is kept confidential. So most of you guys, when you get into your clinical area, you guys will be reminded on all of those safeguards that are important for you guys to do. There is fines. And I'm sure if you work in different facilities, you probably have heard about individuals who were maybe let go from a particular facility because they did dispense information, and then it's a minimum of, I guess $25,000 is the maximum, but it can be a real hardship to those facilities. So if someone does accuse you or you are found, violating those HIPAA rules, it can be, pretty significant. So we know that as students, we are only going to be accessing the information that is important to you, which is just your own individual patients' charts. We can't go looking for neighbors or friends who might be in our facility, whether it be an acute care or a long-term care or subacute rehab. All of that, as long as it's not important to what you do, you cannot access that information. And just even, you kind of wonder, well, we debrief or we do post-conference, and that's okay, as we discuss our patients, but of course we never use any identifiers or, any discussion kind of outside of that environment. So we're not talking about our patients in the hallways, in the cafeteria or break rooms or, in the elevators, just again, because that's protection for them and for ourselves. Now, of course, we have access to computers, we have access to our phones, and we certainly do not want to be using those for anything that can be detrimental to our professions and to our careers. We also want to make sure that when we are using computers, and because I'm only at Spectrum on 8 Center, we're really fortunate that we have little cubbies that we use for our accessing our information. Sometimes we use the WOWs or the workstation on wheels that are in the hallways. So we always have to make sure that if we're using those outside of the patient rooms, that we make sure that screens are not, towards the what do you call those? Visitors, thank you. I knew it would come to me. To anybody who might be able to, access that information that really shouldn't be seeing that. I don't know if we use fax machines that much anymore, but if we do have information that is being transmitted over, oh my gosh, I can't think. Internet, but copy machine. my gosh, I am not in education mode yet. But anything that we might be receiving from different departments or anything, make sure, again, that they're not, any copies of anything are kind of left out for visitors or for even our patients to kind of be looking at. So always want to make sure that we destroy any information, including any of our worksheets that we might use that might have that sensitive information available. Social media. And that, again, is something that we're always kind of hooked up to our phones. And that can be really on anything such as Facebook, Twitter, Snapchat, all of that. Now, we really shouldn't have our phones right on the clinical area. There are a lot of new policies, even in regards to the Apple Watches. Or does anybody else make a watch? I mean, everybody makes watches, but I mean, does anybody have like a watch that you can get all that stuff on? Is it just Apple? Garmin, okay. So they don't even, smartwatch, thank you. They are even, again, developing policies. Make sure you know the policies for your individual agencies or environment that you guys are going to be doing your clinicals in. Especially when you have access to emails and your cameras and everything. Even if you're not doing it, if you're in a room with that being open, there's always that suspicion. So make sure all of that isn't even really taken into that environment with you. These are really valuable tools. I mean, it's so much easier to look up a drug or a diagnosis on your phone, but it just is kind of that, perception of what you're doing with that phone out in your patient's room. So again, make sure that you know all of those policies. And then, of course, we never take pictures of any of our patients, or we never post any information in regards to our patients. And even if you try to delete, my husband's favorite little mantra is digital is forever. So no matter what, if you delete it, it is still out there somewhere. So anything that you might post in any of those social medium forums can affect you, even later on in your career. And you guys don't read the newspaper, but you guys all see, I know, I told you I was old, I still read the newspaper, but there's always articles that you will see of individuals who are, even arrested for certain things that they have posted or talked about in regards to that social media. So it is all that breach of that confidentiality.
What about if your patient would befriend you on Facebook?
Oh, do we friend patients on Facebook? No. As a matter of yeah, and I know it is so hard. It's like, oh, I want to get that 1,000th friend. I actually think I have like 100 friends. Just friend them. And we do build relationships, but there is a line on where we must go as far as our relationships. It should be strictly professional. And then you can be reported if there is any issue between you, a patient, a facility. It can go back to the Board of Nursing. And you guys will talk more about that, but you can have like sanctions on your license, which can actually inhibit employment later on in your career. So just always remember, not even have your phones with you wherever, and make sure that you are, comfortable in everything that you do. I think that's kind of it. Any questions in regards to, I know you all have questions on HIPAA. Okay, Janine's up next with professionalism and excellence.
All right. I have talked about this in the past, so this year I did something a little different. I reached out, sent an email to several past managers, educators, some seasoned nurses, and I said, what does a professional nurse look like to you? I just kind of wanted their viewpoint, and people replied. I got replies, wow. Yeah. The professional nurse owns nursing as a profession, is able to recognize the gift we are given to be trusted by our patients when they are most vulnerable. The professional nurse would not ask others to do something they would not do themselves. So is there any job really you shouldn't do? Right, there's no job that we should not do if someone else is doing it as well. The professional nurse is focused on follow-through and trust. One manager said, she talked about 3 characteristics: communication, compassion, and competence. A professional nurse wants to be there to help their patient at their lowest point, to put themselves in the patient's shoes for a shift and understand what they are going through while staying positive. Being present with the patient. This was a nurse friend of mine. Another thing that comes to mind is their phone activity. They just can't seem to stay off their phones. They said it, and I would say it too. So we just be mindful of that, because we get phone calls sometimes, especially at observational experiences, when maybe there's just a lot of phone activity going on. Another one, someone who not only provides patient-centered care, but is also engaged in the unit. Someone who is motivated to drive positive change and seeks out learning opportunities. So instead of just complaining, I don't like this, I don't like that, being on some committees on your floor to make some positive changes. There's a lot of good organizations within your floors, within the hospital, and you can do some very good things. The nurse who is unwavering in their desire to learn. And I got a lot more, but just some really good feedback. And as we look at some of these attributes of the professional nurse, they kind of fall into that. Knowledge, that's what you're all here for now, and that knowledge never stops, right? You're always gaining new knowledge. Spirit of inquiry, asking why, using evidence-based research, being accountable, owning it is huge. Being innovative, a visionary, that collegial and collaborative, so working together, because we work with lots of different members of the healthcare team, so those are all part of being that professional nurse. Oh, no, let's see. Appearance. Should appearance matter? Really, should appearance matter? In some ways, it kind of shouldn't. I mean, if you're a good nurse, you're a good nurse, but we have all chosen a profession where it matters, right? First impressions are really huge. When you walk into a patient's room, they size you up in about 6 seconds. So appearance does matter. So there's a lot of rules that go with that. Dress code. We're now all on the same dress code now. Everybody's on the same uniform schedule now. So the pants and the scrub top, if you do wear a jacket, it needs to be a lab coat, not a fleece cover-up or a warm-up jacket. Do need to have your name badge on. You do need to identify yourself as a nursing student. We need to identify ourselves as nursing instructors. This is a safety issue. Shoes, socks, laces all need to be clean and that. When you think about facial hair for guys, fingernails, and jewelry, what are we concerned about? Germs, right. You've seen those beards. Boy, they're the thing now, down to the floor, right? So what do we say is how much facial hair can be? How many inches? That's not even, it's half an inch. A half inch or less for facial hair. So if you need to do a little trimming before school starts, you might want to consider that. Fingernails, again, the infection control, even the nice shellac nails and the fake nails, the bacteria can get in there, that kind of thing. Jewelry, what's acceptable? Yeah, so, little earring. They say one earring. Nothing in the nose, nothing in the tongue, nothing in anywhere else. You know what I'm saying? So, visible. Well, I'm just saying that, okay? It's my own public service announcement. Tattoos. Can you have a tattoo? Sure. What do you need to think about? Just having them covered. Why is that? Thoughts? What? Wes, what were you going to say? So we just keep them covered. Can't chew gum, can't chew tobacco, no potty mouth on the floor. Wes, I'm talking to them. And no smoking. Okay, so just some of those things. Think about first impressions, right? It really does make a difference. The excellence system. Davenport University has a mission statement, and I love it. It says, Davenport University prepares and transforms students to achieve the highest level of academic performance, leading them to excel and advance in their chosen fields in the 21st century. So for several years now, we've had this excellence system. It consists of 9 learning outcomes. It's not just nursing, it's every student who goes to Davenport. And the reason is we want to make you a very well-rounded student. You'll all get your nursing, but there's a lot more to it. Davenport is known for its graduates getting jobs, being very successful, and we think it's because the students are really well-rounded. They know what's needed to kind of move forward once they get into the workforce. These 9 outcomes are threaded throughout your curriculum. You're going to see them in your syllabi. You might see reference to this assignment is related to a Davenport University Excellence System requirement. So you might see them in the lecture classes, in clinicals, and labs, and we just want you to be aware it's a good positive thing and why we are doing it. There are 9, and they're divided up into 3 categories. So we've got leadership, communication, and personal excellence skills. So, for instance, the leadership and teamwork, health promotions for juniors will have an assignment that goes with that. For the seniors, their leadership clinical will have one. That analysis and problem solving, critical and creative thinking, very important in nursing. Evidence-based research, I think, has an assignment with that. Clinical paperwork does. Communication, we always stress SBAR, and there's a reason. You need to be able to professionally communicate, and you'll be working on that throughout your clinicals. So there might be some assignments that are tied into that. And then those last 3, the personal excellence skills, that global and intercultural competence, really important because we have people from all different areas in our healthcare system. So we need to be able to interact appropriately. Community nursing, I know, has an assignment that goes with that global and intercultural competence one. The juniors in the 334, they have for the civic and social responsibility. So you're going to see these threaded, and it's a good thing. When you think about adding your nursing knowledge and all of these skills, a very well-rounded student you can be. And then the last thing is ethical responsibility of nurses. And I've got that very first bullet point there. The College of Health Professions students are expected to follow the Code of Ethics for their profession. We use the American Nurses Association. They have established, it's called the Code of Ethics for Nurses. It's online if you wanted to look that up. There are 9 of them. I'm just going to talk about a few of them. As a nurse, you practice with compassion and respect. Another one, your primary commitment is to your patient and probably the families. Being a patient advocate, that's really huge. And a last kind of big one out of that, maintaining nursing competence and growth as a nurse, always learning new things that come out, being aware of new research. So evidence-based research is a big deal. And these kind of fall in line to those professional attributes and skills that we talked about a little bit earlier. So that's all part of the ethics. So any questions on any of that? Okay.
I just want you to turn around and look at the back, and Gloria Johnson is going to wave. Woohoo! All right, if you, and I know all of you have met Gloria Johnson, and she is the nursing advisor. So look around at how many there are of you, and look at how many there are of her. One very, very, very small Gloria Johnson. So, yeah, if you have questions about your schedule, nursing is not self-scheduling. Very, very important. You don't self-schedule your nursing courses, correct? Okay, Gloria's your lady.
All right, my name is Stephanie Berry. I am the Student Nurse Association president for 2018-2019. So kind of wanted to give you guys some information. This is a student-run organization that you guys can be a part of. It's for nursing students only. So if you want to be involved in the community, be involved in the nursing cohorts, this is a great opportunity for you guys to be a part of. Not hard to do, not a lot of requirements. It might sound like it, but it honestly is really easy to do. So I want to introduce our 2018-2019 board members so you guys see their faces. If you have any questions throughout the year, you can reach out to any of them in the hallways. So, like I said, my name is Stephanie. My VP, Vice President for this year is Kelly St. John's. Kelly, go ahead and stand up. Stand up, Kelly. Thanks. Community Chair is Danielle Inman. Our fundraiser is Jenny Bigsby. Finance is Amy Johnson. Secretary is Taylor Wilson. And pinning chair is Maeve Sweeney. And then our faculty advisor is Margaret Smith. So as you can see, we have a lot of seniors on our board, so that means a lot of board positions are going to be opening up for this next year. So if you're interested, start thinking about it. Some of the benefits for SNA are one of the big things is leadership skills that you develop and that employers are actually really looking for and really wanting. They have made comments to us when we've met with them throughout the years that they really love seeing new grad students that have leadership skills or are part of organizations. So this is a big resume builder for you guys also. Also in community involvement, if you like doing things in the community, we do events, we do donations. So this is great, like I said, easy way to get involved. And then you can connect with other nursing students throughout the cohorts. So you can get tips and tricks on how to make it through every year. Books, if we have, the upperclassmen has books that they no longer use, we tend to try and either sell them or donate them to underclassmen that could use them. Great opportunities. So we do have two ways that you can sign up. We use a Facebook group page, and then we also use Engage, which Engage is currently not working for you guys yet, but we'll let you know when it is. That is where you'll sign up for events, donations, fundraisers. You'll do your tracking through there. So that's our main form of communication. And then there are handouts that we have, an SNA table that will have you guys, you can pick up. It has all of our potential and there's potential and already current events, opportunities, all of that going on that we've already scheduled. There's also a handout on MDF instruments that we're doing as a fundraiser. So if you have picked one up, it looks like this. You can get stethoscopes, blood pressure cuffs, bandage scissors, pen lights, all things that you're gonna need throughout the program anyways. And we have a website that you guys can go to and order them online. So that's opportunities for you guys. We do have an SNA table that's down in the nursing hallway. You'll see a board that will have all of our board members, pictures, informations. We have pictures of events that we've done, handouts that we want you guys to have throughout the year about upcoming events. Anything that we have is down at that table in the nursing hallway. And then last but not least, we do have our very first meeting of the year right after orientation and after the breakout sessions. We will be using Sneeden meeting rooms 2 and 3. We don't know exactly what time it'll be just because we'll see how quickly we get out of here for the breakout sessions, but we'll let you know before orientation. Anybody have any questions? Yes.
Would they like to know about the great chords that we also get when
Yes. So one of the other perks that a lot of people really like is that with graduation, once you meet the requirements for your junior and senior year, you get these nice leadership cords that you are presented at your pinning ceremony, and then you wear those to graduation. So it's another nice recognition for all of your hard work that you do throughout the couple years that you're in SMA. You'll get more information at our meeting if you guys are even interested. You're not like sold on it yet. Just come to our meeting, get some more information, and we'll talk to you about our upcoming events. Okay?
All right. One thing that kind of slipped my mind, but Stephanie brought it up. The nursing area, if you've walked down to the sim lab in the last probably 2 weeks, you're going to notice some renovation. So currently, right now, faculty is not on the lower level. We're all hidden in cubbies up on the second floor. So we've been told that the nursing office will be open again before the start of school. So if you do walk down there looking for us, we have been relocated. Construction's going on, so be careful. We try not to get people in those offices. But next on the agenda, we're going to we're moving a little bit fast, and Ethan was kind enough to come in a little bit early. So we have Ethan Tanis from Career Services. And yeah, he really does deserve a huge round of applause because, Ethan, you don't have a slide, but I think of you more than a slide, okay? So one of the things that Davenport works really, really hard at is not just creating relationships with our students, but building relationships with our clinical agencies and being able to get you into the workforce. And so, kudos to Ethan. You can't probably build a resume quick enough, right? You probably want all the sophomores to have theirs done, right? Okay, yep, before they come in as freshmen. But we just got to talk about, and really this is a lot to his efforts. We have 34 of our 35 students from our past graduating course, and they all passed their boards, so 34 out of 34. Or 34 out of 35, the 35th one hasn't tested yet. And 33 of the 34 are all employed, and a majority of them were employed before they left EU, so it's all you.
Yes, so thank you very much. I absolutely love all of my nursing students, so you guys are all go-getters. I do have a stack of business cards. I'll just hand them around. If you want one, take one. It has my contact information. So yes, in career services, I spoke to some of you last year, probably same time, same place. But our job is to make sure you guys are ready for the employment side. Your instructors are obviously making sure you have the skill set, but we work on a lot of that, like I said, professional development stuff. So what does that professional development stuff mean? Whether that's your resumes, cover letters, deciding to do the job searching process, interview prep. Some of you, all of you are awesome. Some of you might not interview well, and that's okay. Work with me. I'd rather have you blow your interview with me, and then when you're ready to do it with an employer, it goes much smoother. I'm here for you. So we can talk through a lot of those strategies and kind of how to market yourself effectively, make yourself stand out, all that good stuff. So quick show of hands, how many are graduating come April? Oh, you put them all over here. So there are a lot more of you than me, but we do have our nursing forum in the spring. It's in January, if not that I'm counting it down, but I believe it's the 24th. But we basically bring a panel of recruiters here and some directors of nursing as well. where you get to ask questions about that process. How do you be competitive in the market and really get the experience you want as your first, out of college role? So we are doing that event, and for that event, we require you to meet with Career Services to get your resume done. Feedback from the last year's seniors is, why did we wait until January to come see you? I know, right? So come set an appointment with me in the fall so we can take a look at your resume and get that ready to go. It is part of an assignment for your seminar, and so you can get ahead of the game, which I know you guys like to do. So come see me, set an appointment with me. My office is literally 3 floors up in Sneeden Center 306. So you can call the call center to set up an appointment. I gave you all the option to take my business card, but get on my calendar and we'll work together through that stuff and make sure you're ready to go on that front. We also have, for all of you, if you're interested, in October the 16th, we have our West Michigan All-College Career Fair, which is downtown at DeVos Place. So there's 230 employers, lots of healthcare employers. It never hurts to just start networking with them, see what opportunities they have. All the big names will be there: Mercy, Metro, Spectrum, you name it. They usually come to this one, so we pair with all the local colleges to run that for you guys. So everyone consider looking at that, get a head start on what it is you're looking for. And what questions do you have for me?
Can you talk about guarantee?
Yes, so all of the pre-licensure group of students are in Davenport's employment guarantee. So there is a list of things on our website. If you log into your Panther Jobs profile, which you can get through your student connections or even your Panther Jobs shell, you'll see Pounce wearing a suit. That's how you get into Panther Jobs, and you'll see the employment guarantee results in a survey there. And so it's a lot of the things you do every day. Don't have a criminal background check, 3.0, a lot of other things that go in there. But basically, if you meet all of those criteria and you cannot find a job, we believe in that set of criteria so much that we back it with our employment guarantee. And nursing is one of now 4 programs that Davenport offers this for, that if you are unable to find employment after 6 months, there is an incentive to continue your education here. But you have to meet all of those criteria because, like I said, we firmly believe in those. And if you do those, you should be able to get a job. So that questions, also refer those to me, and I can help you through kind of what that entails on our website. You'll see it labeled as our professional development plan. You'll also find our career guide. Our new one is at the printer right now for next year's version, but there's a lot of resources in here that our office, worked very hard on to make sure that you guys have what you need in hand. So you'll be getting those as the year goes on and as you see us, or just stop by our office and grab one if you just want a good starting block for a resume, or you have an interview tomorrow and you're panicking and you just can come and grab one and kind of review some of the stuff in here. Thanks. Any other questions? Awesome.
Do you talk about the health and wellness piece?
I do not hold the... Yes, correct.
All right, thanks. All right, we're going to peruse right along here. Our panel will be showing up around 10 o'clock. We have a couple of our graduates that I don't see here yet, so I'm going to move forward. Resources that we have available for students. Margaret did talk a little bit about that as far as IT. I really can't stress that enough to you. For those of you that have, and I should have all of you really, in Health 101, if I don't have you in there, make sure that you email Gloria because you should be in that course. But there are many things that IT can help with, expertise that I do not have. And there's 178 of you, and there's far more IT support that you can get from them. So please look at the phone number and contact them if you have any problems with a web browser or any type of attachments. Our team works really hard to kind of get back to you within 24 to 48 hours, but I know that's been a little difficult with Health 101. I'm going to actually start from the bottom and talk about the CARE program. The seniors, prior juniors, are informed as well as the sophomores. So our CARE program is about student success, and we really work hard to develop those relationships with you. And nursing school is not easy. It's, most of you come in really excited and passionate for the profession. You've gotten really great grades, and then you take your first nursing fundamentals test or your nutrition test, and you go, I hate nursing school, this is ridiculous, this is the dumbest class that they ever put, and we shouldn't have nutrition anymore. So, would you say that about nutrition? Yes. So anyways, it might be going away someday soon, so. Anyways, but you won't see it. But anyways, with that being said, there is a real piece that students are going to struggle. And, I always share with my students, I was a horrible test taker. I was so stressed out. I learned tactile, and that's why I love our simulation lab. But testing was not a great tool to evaluate my knowledge. And so when you sit in that classroom and you're taking a test with all of your peers around you, they're going in, they're going out, whatever distractors that might be there for you to be successful. And so what we talked about in the last couple years is what can we as our team do to help each of you be successful in the classes. And so one of them is test-taking strategies. And we worked rolling that out last year with each of our groups, sophomores through seniors, and just went in to talk to you about what does an application question look like? What does a memorization question look like? Why do nursing questions look so much different than any of the other courses that you've ever taken? And then, once we decided, if you get below that 80 grade in a course, then it's a partnership. We want you to be successful, but there's a part that you need to have as well. And we initiate what we call the care plan. And once that's initiated, then we meet with each of you, depending on who your instructor is. For that course, each of you will meet with that person, and we just talk about some real things. What's going on in your life? Initially when we rolled this out, we thought, it was going to be all about test-taking strategies, or it was all going to be about anxiety. And then we realized all of the stress that you have in addition to that. Many of you are working full-time. In our packets, we have data and statistics that show that if you're working more than 16 hours a week, and just nod your head if you're doing that right now, and I think I've already heard from a lot of you over the summer how many hours you're working, anything greater than 16 hours a week is going to impact your grade. And so we know that, we have that data. So that's going to be one of our first questions that we ask. Now, there's a real piece that we can't change that. Many of you may have to do that, but what can we do? What can my team do to help you to be successful? And so then we talk about what does your study habits look like? Well, first, the million-dollar question is, are you studying? And some people didn't need to study before because they were an auditory learner, so they remembered 90% of everything that was said in class, but then didn't read the book. And so in nursing school, this isn't the program where you decide not to read the book. You have to have the textbook. It's very important. If you can't afford textbooks, please let us know so that we can figure those pieces out. If you're working in study groups, some of the students will share textbooks, especially when you get to leadership and community, so we can talk a little bit about that. And so what did we come up with? So we collected all this data for the last couple years, and I shared a little bit about our numbers. We had all 34 of our students, our past graduates, pass, so that was excellent. We had 33 of our 34 students pass the NCLEX the first time around. We had one student that was a repeat, and she passed the second time around. And then we have our last person, our last graduate who's going to test yet this month. So we really decided that the CARE plan does really work. I know that is time consuming for you, but we are really all experts in our areas that we teach. And so we want you to take the time to be able to talk to us and communicate to us, what are your struggles? If it's financial, many of you I've talked to during the summer. And so we had an opportunity for you to apply to a scholarship. Or you applied to Michigan Works. But all of those pieces decrease your stress for you to be successful. And anything else you feel like for the care plan? All right. Questions about the care plan? All right. Health 101. Health 101, and really for all of you here, a majority of you, unless you're a transfer, should be in Health 101R. And I spoke to Gloria at the break. If you're not in that course, please send her an email or just stop by and touch base with her. It is a requirement from all of our clinical agencies that you be cleared for a drug screen and criminal background check. Now, those results are all confidential, so those aren't pieces that we need or do get the results of. There is a process if anybody has a hit on their background, and it's really important that we stay in communication. The student's responsibility, if they do have a hit on the background check, is that you need to email me, and then I need to represent you when we go to the compliance committee. And really, that's just I'm really your liaison and to fight for you for your case, but I can't fight for you if I don't know what your case is. And so in our field of nursing, there's very few things that we can get away with and still practice as a nurse. And so when we have alcohol charges, when we have abuse is a big thing, especially if you abuse a dog, you can't go into the long-term care facilities. That's a big no-no. So those pieces you need to be honest with me, and then I fight your case with the attorney that represents Davenport at the compliance committee. Any questions about that at all? At this point, Health 101 in the Blackboard shell is interesting because there was an email sent out July 20th and I believe August the 1st, and I would say there's a large portion of you may have got it and a large portion of you did not get it. So we're not really sure what we're trying to figure out behind the scenes, but all I want to let you know is if you haven't looked at the course yet, please take a look at the course and complete steps 1 and step 2. That is only paperwork as far as you setting up your test and some documents that you need to sign. So it's not a requirement that you send any of those results to me. That's none of my business. I don't need to know any of that unless I'm fighting your case to go to the compliance. Any questions? All right, I don't see Javante. And so we got a couple minutes. All right, I'm gonna ask a question to the seniors. And this is gonna be directed to the sophomores who still have nutrition and fundamentals. All right, so what was the #1 study tip that worked for you that you want to share with the sophomores?
Read your PowerPoints over and over again, and then maybe one more time. And I also rewrite them.
Anybody else?
If you're confused on like what the context is saying, then go to your instructor and ask questions because they can really clarify things that you're confused on.
I always tell students perception is 90% wrong. So when we get a group like this, I might be saying something and I got 177 different opinions about what I'm saying. So make sure you ask for that clarification.
Especially for fundamentals, definitely take advantage of the quizzes at the end of each chapter. I know in the past, some of them were like direct content onto the test. Obviously, I don't know how they're going to be now, but they definitely prepare you for how the tests are going to be worded.
All right, so really important question for the seniors to the juniors. How do you handle Janine Blakesley? They're kind of stuck with her for 250 and 334. What do you see as the most important thing to deal with Janine?
Laugh at all her jokes. Laugh at all her jokes.
Go to all of her lectures because they're amazing, and you learn a lot in class. She's a very good speaker in class, and I love her.
And there are surprise tests that she will not tell you about, so definitely go to every lecture.
I would say be you and be real. I've been able to connect with her, and she really will be close with you and follow you through with whatever you need.
Janine is one of your biggest advocates, especially in med-surg. Don't be afraid to go talk to her. I have gone into her office and said, what is going on? Please help me. It's not, don't be afraid. She's great.
So, interesting comment, you should go to the lecture. That brings up a really important part of the student handbook that I didn't add, but it is a requirement for you to go to class. If you have friends in marketing, they won't go to class. They've had a lot of fun the night before, or didn't come home the night before, okay? And so nursing is notorious for having morning classes. We'll be one of the few programs that get slotted from 8 until 10, and you're gonna notice that marketing, sales, anything else will be from 10 until 2. But a majority of our classes are gonna be from 8 until 10, 10 until 12, and then the labs traditionally 12 until 2 or 12 until 4, depending on which one it is. Okay. Attendance in clinical. Attendance in clinical is required. And so what does that mean? So you obviously need to come, and we need you prepared. We need you dressed professionally, and you are not allowed to work the night before, okay? That's not anything that we can change. That is a policy of the clinical agencies of where you're going to be. So a lot of this is dictated to us as to how do we get you prepared to be successful for clinical. You know, for our seniors, they're going to be in OB and peds at first, so it's not uncommon that they're going to be exposed to things that might make them a little upset to their stomach. And so maybe a vaginal delivery with a postpartum hemorrhage afterwards. So we do request all students to eat before you go to clinical. It's very important that you have a high protein, about 20 grams of protein in the morning before you go. When you show up, and caffeine. And when you show up, we do need you functioning within your scope of practice, and you're going to learn that from us. We never expect you to go into a patient's room that you know nothing about, so don't ever do that. Go to your instructor or whoever is representing you at that clinical site. Makeup for clinical is required. The Michigan Board of Nursing requires each of us to have a certain amount of hours when we go to clinical, and so we have to make sure that each of you meet those numbers. So if you miss a day, you have a life event or whatever, you need to let your clinical instructor and Shelley know. Send an email ASAP so that we know, so we don't make an assignment for you and that a patient isn't waiting for you. And then we will schedule makeup time for you. So it will be a requirement. We do have points, and students love points. And so you will have points attributed to makeup, and you will have points to assignments as well.
Can I talk a little bit about makeup? So this year we're going to do something different. We are going to do all of our clinical makeups in the lab, running a simulation. So it will look different for you seniors. We are having a hard time getting you to get placed into other different clinical groups for makeup. So the week after clinical will end, so typically I think it will be exam week, will be makeup clinical time. So you are only allowed to miss 2 clinicals. We say allowed, but you do have to make that time up. If you miss more than 2 clinicals, you do have to withdraw from the program. So it's very important that you are in your clinical. Part of that is because I don't want you to be my nurse and you didn't go to your clinicals. if that makes sense.
Is that per semester or for your entire time to miss 2 clinical?
That is per clinical class that you are in.
What if you have 2 clinicals in the same day? So does that count as missed 2 clinicals?
The seniors are the only ones that have that issue, but yes, it would be 2 separate classes, and so that would count as a miss for each class. They're each a separate class. For 12 hours?
If you miss clinical and you have 12 hours, do you make it up? Are you in the lab for 12 hours?
We have the flexibility with simulation to have the simulation be a shorter period of time. But with that makeup simulation, there's going to be a lot of prep work that you have to do, which will be a lot of that time. It will be stuff you're doing before you actually show up here for that makeup day.
Did you have clinical questions at all? All right. I do not see Javante. All right. Let's have our panelists come up.
Okay, so we have our panel up here. We have one more graduate that may be showing up yet, Megan McDonald, so we'll see if she arrives. But you first just want to introduce yourself and tell what year you are in, and you can tell a little more about yourself.
My name's Felicia. I graduated in April. I am currently working at Pennock Hospital in Hastings in their emergency room and love every minute of it.
My name is Jenny, and I am a junior this year.
My name is Carla. I'm a senior.
My name is Lindsay, and I'm a senior.
My name is Amanda. I'm a senior as well.
I'm Maeve. I'm a senior.
I'm Dan. I'm also a senior.
We've got a good team up here. What kind of questions do you have? I see one. Shelly, are you on that?
I have one specifically for Jenny.
Yeah.
Can you explain what's going to happen on the 4th? Yeah, the whole deal that's happening on the 4th.
I have no idea.
It's the first day of class.
Please show up.
They're about like meeting clinical instructors. It was an email that was
I can answer that question for you. So for the junior class, September 4th, the first day of school, half of you are going to meet on campus in the morning for a medication blitz. The other half will be going to their OR orientation, whether you're going to Mercy Health or Metro Health. I will be sending out details in regards to who's going where after this week.
And I'll talk more to you.
But plan on and then for the other half of the day, so those of you who did your OR orientation in the morning will come to Med Blitz in the afternoon. Those who did Med Blitz in the morning will go to OR orientation in the afternoon. So that's what Tuesday the 4th is.
Okay, any other kind of questions to someone? Put it on the spot. Questions?
I'm Flex. Best way to prepare.
Good.
I cried a lot. So I made it a full-time job. I was lucky enough to not work before taking it. I did 100 questions in the morning, 100 questions at night. I remediated. It was 6 to 7 hours of my day, every day. And I did the Kaplan course in seat, and then I waited 6 weeks after to take it. So it has to consume you, I feel like. But walking in there, I felt prepared. You walk out feeling like you failed. You know nothing. But it went great.
If some of the seniors now could speak to clinicals, especially to the, I would say, well, really sophomores and juniors, but what's those first clinicals like? What are some tips? How to ease some of that anxiety walking into those first time into the patient's rooms, expectations? Any tips?
Don't say no. Don't be afraid to go in and be like, I don't know what I'm doing. I will watch you do it. I will help you do it. Walk me through it. I think that's huge to get over that confidence that I think is lacking that first couple clinical weeks.
And always ask your nurse, like, about other patients that they may have. Like, always be willing to help out with more than just your patient.
I would say that just like be confident in like your ability, but don't be afraid to ask questions. I feel like time management's very important. Like, try to get your assessments done early and pass your meds so that you can like find out other opportunities and see things that aren't necessarily just with your patient.
Research your medications. Once you find out what meds you have to pass, make sure you go and look them up, because your instructor will ask you what they're for and side effects of them and things to monitor and look for. So it's definitely good to make sure you just know all about them.
Don't be afraid to ask questions. We're nursing students. We're not supposed to know everything. So it's okay to ask a million gazillion questions before you go into that patient's room. It's important to feel confident when you walk in that patient's room.
I'll say, and I got this tip from one of my instructors, take the time to get to know your patients. Use this time to really hone in on some good communication skills, because as a nurse, you might get like 4 or 5 patients, so there's not going to be another time where you're just going to have 1 or 2.
Does anybody want to speak to time management? I know Maeve's an athlete, we've got some moms. Anybody want to talk about, and one of you work a lot, about how you juggle time management?
You don't.
I have 2 little kids, so sometimes it's hard to find time to study. But what I have learned is using your community, your families. If you're stressed out, you have kids, and you have that around you, your friends, ask them to take your kids for a little while. I just need to study, put them to bed early, ask your significant other. Use the people around you, use your friends and family, and you'll find those are the people that really get you through nursing school. And communicate with your teachers too. If there's something that's going on in your life, let them know. They're very sweet. They want you to succeed, so just communicate with them too.
So being an athlete, it took up a lot of your time, going from school to practice to game to you're on the road on the weekends. It just took up like a lot of time. So I am a crazy planner. I like live by my planner day to day. I am a highlighter, a crosser offer, color code everything, big on Post-it notes. So my huge thing was just getting that planner and going from day to day and like what to look to, what I have next, what I have to do throughout the day, throughout the week, and kind of go by that. That really like took over my year on how to plan accordingly.
I'm the exact opposite. I'm a hot mess. And I had a baby while I was in nursing school. And so I found myself, and I know somebody else in my senior class did too, Melissa, and we talked about it. I found myself waking up, at 3 in the morning with a baby and trying to study. So what she said, use your community, communicate with your instructors, but also schedule time for yourself to, like if you have Tuesdays off, don't book it full of stuff that you have to do. Like, say, I'm going to study for 3 hours on that day or do homework or whatever.
Introduce yourself, and then, so one of the questions that they asked about was prepared for NCLEX, so I think that was pretty particular.
So hi, I'm sorry I'm late. I came from work. So I graduated in 2017 from Davenport with my BSN. So a year before Felicia. And I currently work as a RN at Metro as a labor and delivery nurse. I took my NCLEX the last week of May of 2017 and failed and got married 2 weeks later. So I don't recommend that. Seniors, don't schedule your NCLEX 2 weeks before your wedding. It's not a good idea. and pretty much thought I was like the only person in the whole world that failed their NCLEX, which obviously we all know isn't true at all. But I felt like nobody else, like all my friends were like, oh, I took my test and I passed and I'm gonna be a nurse. And I was like, great. And it felt like, I felt so happy for you, but also my life sucks. Like, it felt honestly like all my friends were just like living the dream and I was like teching it, and yeah. So I took like a month off. I got married and went on my honeymoon and took like a month and just like pretended that it never happened. And then I just got right back in it in July and August, and I took the NCLEX I think the last week of August. So I took it again and passed in 75 questions, and it was like so different. It was just crazy that it was the first time I took it. I got 250 questions. Yep, go ahead, let it out. I did for a month, so I can't believe my husband still married me, but he did. And so it was 250 questions, and the whole time I was like, I'm passing, I'm failing, I'm passing, I'm failing, I'm passing, I'm failing, I'm passing, I'm failing. And yeah, it really knocked my confidence as like a person, but as like all of the instructors here will tell you from experience, I was a horrible test taker in nursing school. I would study and study and study and be with friends and like studying, and they would help me, and they would get their 90s, and I would be like, 81, this is great, like I passed, like who cares? I told Janine in MedSurg too, B's get degrees, and it's gonna go on my gravestone someday, because it did. It sure did.
Should you change a lot of things before you take the NCLEX, or should life just try to remain status quo as much as possible?
I mean, you're gonna be anxious and nervous. If you're not, then that's awesome. But you're probably gonna be, I mean, if it's how many years, months, dollars, time, stress is going, I feel like I'm only talking to seniors, sorry, is going into literally your whole life is riding on it, which is how I felt, which is totally normal. But even if you don't pass, it's not the end of the world. I would not recommend getting married 2 weeks after, or any sort of major life event, for that matter. I don't know what other, like having a child, but you can't really control that. But I thought it would be better if I took it and got it over with, so to speak, so it wasn't looming over my head, and learn from my mistakes. Let it. I just wasn't focused 100%, and I think that's what really did me in. Not that I wasn't serious about it. I was studying. I did the Kaplan course, which was amazing, and I would recommend it to anyone. I used all of that the first time I took it and the second time I took it, and I don't think that it had anything to do with me not passing the first time at all. I think I just wasn't 100% focused.
We're going to have you hold on for just a second. Javante's here. You want to come on down? And they just started their questions.
How you guys doing this morning? Good. All right, so I seem very important. She just cut you guys off for me, so that's nice. My name's Javante Ford. I'm part of the Center for Campus Life team, which is located directly outside of these doors here. I had a PowerPoint, but it doesn't take too much work to pull up, so I'll just go off the top of my head. Some things that we do over in the Center for Campus Life is we have student resources. We have resources for our students. So that's where we have accommodations. So if you need to take your test a little bit longer, if you need assistance with someone possibly reading your test, or I know that we work with a lot of athletes who have injuries, need to miss time away from school, any of those things, you would simply come down to the Center for Campus Life, talk with Joe Bishop and his team, which consists of Cassie Clark, and they will be able to assist you with anything that you need there. Also located in our offices are the housing and residence life. How many of you are living on campus? Awesome. I see a couple of RAs in here. So I actually just had a presentation with them. Also, that's where you would go to sign up for housing. If you have any housing questions, simply walk down to our office to get that information that you'll need there. Located with the team that I work with is the student life team. So we focus on student engagement and having our students involved, whether that is on campus or off campus. So how many of you attend some student events on campus? All right, good. What about the 30 Thursdays? Awesome. So 30 Thursdays is what I oversee, and so every Thursday throughout the year we have an event going on. At first, when I walked into my position, I always thought, I'm going to make the coolest events, we're going to have a ton of fun, but I realized I'm old. And the events that I will essentially put on is not what you guys like. So please help me and do my job well, and just kind of brainstorm. A lot of the events that we'll have this year is all because of the students came back and said, hey, we would like these events to happen on campus, whether that is canvas and sparkling wine. I had to put the sparkling because we actually put wine on a poster and students thought they could drink on campus. So just doing some things like that, going out to the Detroit Pistons games, Detroit Lions games, paintballing, corn maze, all of those events that my team, we want to help you guys have fun here. So we all know that nursing is a very rigorous program. I got to hear about you guys talk a little bit about it and how nervous you are about taking the NCLEX and how you may fail, how you may feel a certain way, any of those things. And we want to be able to relieve some of that stress. So regardless of what that looks like, we want to be able to help you guys, whether that is bringing in therapy dogs. How many of you attended the session with therapy dogs? I feel like we had a lot of you students with therapy dogs, so that really made me confirm that I did not want to be a nursing student. No, just kidding. Another thing that I really wanted to promote is we also just launched our new website, which is engage.davenport.edu. So when you go on there, I'm talking a lot about the student events, RSOs and things of that nature. But when you go on to our new Engage platform, you can actually filter through everything. So if you're into volunteering, you can go on there, you can filter through volunteering, and it will take you to all the events, programs associated with volunteering. I do know we had Active Minds they were just putting out events all year long. SNA, how many of you are a part of SNA in here? Awesome. So that's where you can go on there. You can communicate. We also have like a discussion board on there where you can it's a feed actually, where you just kind of talk about events, talk about what's going on, and it's very interactive with students. It's very different from the previous platform that we had. So I encourage you all to kind of go out there, just play around with the website. Once again, that's engage.davenport.edu, and just get very familiar with that, and it's going to be a really nice website for you guys to just engage with one another. Let's see, what else did we have? Oh, and then are there any incoming freshmen in here? No? So Panther Prowl is not relevant. Every Wednesday, so why you should visit our office. Every Wednesday we have popcorn throughout. It is free. Come down, we got all your seasonings for you. Just don't overdo it. But yes, every Wednesday is Popcorn Wednesday. We just want our students to just come down and hang out in our office. I don't think there's too many, areas where you could do that, but we really love the interaction that we have with students. So being able to just come down, talk about, what's going on, how can you get more involved. We all know that you all have different passions. So coming and saying, hey, you know what, I really have a passion for helping the youth, or I know some students came down and said they really had a passion with helping and participating in Special Olympics, and so now we're helping get that up and running for that student. So anything, I do not want to come up here and say, we only do certain things, but really our office is the end all for everything. It's just come down, communicate with us. We're going to help you throughout the whole entire process of getting you to be yourself on this campus, whether you're a commuter or you live on campus. A lot of our events are tailored towards both sides, whether that's on campus and also commuting. So you can still be a part of the Davenport community. With that being said, I think I covered a lot. Do you guys have any questions?
Did you talk about like the litter box?
Yes. So I also oversee the litter box for people who go to the restroom and read the litter box. If you would like to promote any event, it's always the 20th of the previous month. So with it being August right now, I would need your information by July 20th in order for it to be on the litter box. Now, everything is not guaranteed, just for the simple fact of there's different departments, different student groups that are looking to advertise via the litter box. And so it's almost about, hey, how much space do we have and what do we need? So the sooner you get it in, the better. Do you mind if I click off this for a quick second? All right. I just wanted to show you guys the actual website. And this is just a shortcut for me. All right, so when you log in, it's going to come to this page. Like I said earlier, anything that you belong to, my page is going to look a little bit different. But if you were to like any group or become a member of any group, anything that's happening, you're going to see in the campus feed over here, and that's just tailored to you. So I know Taylor talked about quick links. If you go the litter box request form, it's going to bring you to here where it has your contact name, contact email address, phone number, what department are you representing, and just a brief description of what you're actually trying to advertise. And this helps me in a number of ways. Just simply if, maybe we need to cut down on the text, I can communicate with you and say, hey, how can we shorten the text but still get the same point across? Or maybe you're missing a little bit of details. I would then reach out to you and talk to you about that and try to get all those details in it so that our students are aware of what's going on. I think something that is very cool is something that we designed was the bulletin board. So where you can buy and sell textbooks. I'm not sure how that resonates with you guys, but buy and sell textbooks here. And that's directly separate from the bookstore. So we all know how expensive books can get. So we're just trying to help our students have another resource to buy and sell books. Marketplace, similar to Facebook or whatever, you can post in there, hey, I have a futon for sale or whatever, Keurig, whatever. Any of those things you can market in there. And then most importantly, we have the ride share. Last year we had a lot of students that said, hey, you know what, I don't know if this, because to a city boy, we are out in the country. So a ride share is very perfect for students who want to just either be a helping hand with chauffeuring students around, or just asking and saying, hey, I need to get to Meyer. Who else is going to Meyer? How can I help you with that? Is it maybe a little bit of gas money, or maybe it's a Twix bar? We had one of our students last year that said that he would spend $15 to Uber to Meyer and then $15 to Uber back. That's $30 that that could potentially go towards his groceries. So we wanted to try to eliminate that as much as possible by creating a website where you guys can go on there, you can communicate with each other and put it on you guys. So we won't be monitoring that, but it will be up to you guys to kind of, if you're commuting from downtown, let's say you have your clinicals and there's several of you, you can say, hey, Monday I can drive back to campus and whatnot. The last thing on there is the roommate finder. This is off-campus roommate finder. So if you're looking to say, hey, you know what, I'm not living in the residence halls anymore, I would like to get an apartment with someone, you can communicate that via the roommate finder form. So, any questions for me? Yep.
Engage. So now with a new platform, everybody has to go back in and re-sign up.
Yes. So depending on what RSO group you're associated with, you will need to go back in there. We did a soft launch and sent it to the presidents and the advisors, letting them know that they will need to then re-invite all of the members, and the members will need to join that program, join that group again. Another question?
I was about to say, so when does this go live? Is it already going live right now?
So we did soft launch. So the advisors and I believe the presidents have access to it right now, and that's just uploading your constitution, things of that nature. But we will launch it where everyone will have full access to it the first day of classes. Any other questions for me? I think I did my job. You guys have a wonderful day.
Any other questions for the panel right now?
Go, Liz.
Did you use any other tools to study for NCLEX besides Kaplan?
I used my med-surg book like crazy. I think that's the one book that I held on to, and every time I would like get a bunch of questions wrong, I would read med-surg chapters over and over and over again. So if anything, I would say that was my biggest tool, other than, like, I didn't do UWorld along with it or anything, because Kaplan gave a ton of questions. And I believe Kaplan is all above passing level questions. So if you were getting 50% on Kaplan, you were doing pretty well.
I did Kaplan practice questions, like 100 million of them. Because it's just not realistic to learn everything. Like 4 years and you're gonna learn what's the side effect of fill in the blank mental health drug here that you probably forgot existed. It's not like, there's just not possible. And fortunately, the questions on the NCLEX aren't that in-depth. They're testing your ability to make a decision and critically think and yada yada. But I just did practice questions. And if there was something, even like a disease or something that I was like, I don't really remember much of this from MedSurg, I'd go back and like look it all up and like that kind of stuff. But I found that just doing practice questions was so helpful because it was more realistic to the day of the test, especially doing practice questions online, because we're so used to taking pencil and paper Scantron tests in school, and then you're on the, like for me, for tests in class, I would like underline stuff and circle stuff and cross stuff out, and you can't do that on the NCLEX because it's all on the computer. So the more questions I did on the computer, the more I got comfortable with that format.
For those of you who work in healthcare, can you address, has that been helpful to you? Maybe you've got a job in the hospital. Has it helped? In what ways has that been positive?
Making sure it's on. Okay. Yeah, working in healthcare is probably the best thing you can do for yourself if you're not already doing it. Just getting the exposure to how the facility runs, you have access to nurses. I would ask my nurses the dumbest questions, like, hey, what's the difference between excoriation and denuded skin? Because it's red, you know? And getting that experience, it builds your confidence at the bedside, which I think is really important as you progress in the program. You can really build upon your skills and then also experience, oh, like that's how that's done in the facility. Not how I learned it in class, but you know, that's a way. So I highly recommend if you don't work in healthcare now, do it.
So I didn't have a job. I did not work in healthcare. I was on the women's lacrosse team and a nursing student, which is like a job. I recently just got a job at Spectrum this past summer, which has been awesome. But for someone who's not worked throughout nursing school, it's doable. I do believe that it has its perks, like working at the hospital, you learn a lot of in and outs and kind of like little things you pick up and things like that. But coming from someone who did not work in the healthcare, I asked a ton of questions. I didn't know a lot. I think like I kind of thought at the beginning that my classmates had like a leg up and knew a lot more than I did, but going into it, there's a lot of things that we don't know together. So I asked a lot of my clinical people, hey, can you help me with this really quick? If they cath people 50 times a day, and I wasn't used to that. Hey, can you help me work on my sterile technique? Or can you help me go through this? So I think it kind of goes both ways. Like, you learn a lot and you feel comfortable and you just get in your niche with it.
Yes, I feel like it really helps you just feel like prepared for clinical. Like I felt going into clinical day one, like I felt totally comfortable talking to patients, talking to nurses, like other nurse techs. I knew like how to like cath people before we even went into like the, what is that, med-surg, the simulation that we learned, one of the two. Yeah, and if you are in it for a while and you can get a job in like a department that you like I started working in an ICU last year and I absolutely love it, and I feel like now I know like, okay, before I become a nurse, like this is the type of field that I want to work in. So yeah, I think if anything, it just helps you feel like comfortable like in a hospital setting because it's very different than just working like retail or something. I don't know, I just feel like it's very helpful. So if you can do it, I definitely recommend it.
They pretty much covered everything. It's definitely beneficial to work out here. Any more questions?
I was just gonna say, I was a medical assistant before, so I worked in a doctor's office, so very different perspective than hospital. And I felt like working in that setting helped me learn medications very well. So I didn't do any caths or anything, but that side of it helped me learn medications, which were really
I'm going to pick on you, Lindsay, so be ready. The ability to see humor I find really important. So at clinical in the winter, we were sitting at the nurse's station, Amanda and Lindsay were in my clinical group, and the patient put the call button on, and it came through, and someone said, "Can we help you?" And the patient said,
Can someone come scratch my butt cheek?
"You can't make this stuff up."
We had a really fun clinical. For as serious as of a floor we were on, it was so much fun. But yeah, we went and scratched some butt cheeks that day.
You'll be fun with that.
Yes.
Yeah, you just have to have fun at clinical.
Yeah.
Like, just make it a fun time, learning time.
Well, you have to understand, like, at that clinical, these were...
Yeah, a lot of these
Patients
patients
couldn't
couldn't
use,
they couldn't
some
do
of
that.
them, like, couldn't move, they might have been on an event, they might have had a feeding, they're restricted to bed most of the time, so, like, that was a valid request, even though
This
it's
one
a
is a
unique one.
Yeah, always try and find like the light side of things. Like, a lot of the time, our past semester at clinicals was very serious. A lot of our patients died. A lot of them were very sick, but we always seemed to make the most of it, and we had a lot of fun.
I just wanted to say the point to the healthcare working also is something that I never took advantage of because I didn't know it early enough. If you work in healthcare, say you go to Spectrum as a nurse tech, after 6 months, they'll start paying some of your school off. So that's a lot of things a lot of people don't think about, and I just started, and now I won't be able to take advantage of it, but it's very important. If you get in there after 6 months at most places, they'll pay a certain amount of your tuition.
Now, with that said, you have to sign a contract for at least 5 years with them for them to pay tuition. So that's why I did.
If you do shorter programs.
Mine's only 3.
Only 5
Yeah.
get 3.
Yeah. It varies place to place, so I would definitely look at Well, and you need to be aware, like, it does depend on the organization. Mercy Health doesn't require you to commit time after you graduate, but they require you to be per diem, or not per diem, budgeted, so part-time or full-time to receive these benefits. And then after you receive that tuition reimbursement, you have to work as a budgeted position for 6 months after. So, I mean, my tuition reimbursement requirements are very low compared to like Spectrum, who might require 3 to 5 years. So it does depend on the location and your status.
Can I speak to like not working in healthcare though? Because I haven't. I've worked retail, and for me, I found that was actually a good.
Nothing against retail.
We appreciate your discount.
several of the nurses say, like I've noticed that you take more advantage because I don't get to see most of the stuff every day. Another thing is that I felt like work for me was sometimes kind of a break because I got to just go talk to people and work retail with them. Be 100% medical every single second. So if you love your job in retail, don't quit it. Like it can be, and a lot of times they can work with your schedule a lot. So you're working less busy.
Juniors, what is stressing you out the most right now?
Is this year going to be easier than Neil and sophomore year? Ooh. No.
I would say be consistent. Like it is stressful, but be consistent. So if you know that the best thing about this is you'll figure out your teacher's patterns, not on the pop quizzes, but but you do know, like you knew every day or on a certain, like every Tuesday that Margaret was going to have this due, or so make a pattern, find your rhythm, and be consistent. If I can recommend.
Planner.
This is from juniors. No, they're ready to say
We have words.
We have words.
For med-surg, you can never study too early. Like, you're like, I'm studying 2 weeks before a test. That's a legitimate thing to say. Maybe some classmates are like, I really didn't study, but take advantage of your time studying, especially for med-surg.
Seniors, we have a little tip for you. Senior year is not better. Peds and OB is like having 2 med-surgists with tests every week. So that little myth that senior year is just cake, no, all lies. That's what both of us had heard, and we were like, no. Yes.
When I was a sophomore, I was sitting in the veterans lounge, and there were seniors in there, and I heard them say that. They said, "Don't think that this is going to be any easier your senior year. It is just having peds and OB together is a lot of work." So
We
that
have you. We're
I
fine.
heard
True.
that 2 years ago.
It was
Yeah.
Because you were at the end, but it was, I want to say senior was the worst.
I wouldn't, I mean, it's. So I would say that each year is stressful in a different way. So the second years / sophomore, second years, is that right? Second years? I'm like, don't remember anything. That year was crazy because it was like, I'm finally not taking like math and English and like, yay, I'm in nursing school, and it was like pharmacology and mental health, and you're like, what am I doing? What's happening? It's so much, and am I going to med school or nursing school? And that's how I felt, at least. I felt like, what? And it's crazy, and then you kind of get in your groove, and you're like, this is nuts, but I think I can handle it. And then you're like, oh, junior year, all right, med-surg, this is the stuff. We're doing diseases and IVs and shots, and like this is what I thought nursing school would be like, but it's a different kind of crazy. It's
cramming more in your brain than you
yeah.
have room for.
But second year builds so much onto third year, and then the more third year stuff that you gain for fourth year is like the critical thinking and like the being able to like see that this, and this turn into this, that helped build into that, which helps build into, you're off orientation, good luck, bye. That was a fun day. I just feel like they're all stressful in different ways, but if you heard a lie that fourth year is a breeze, not true at all.
And I just want to say that there's one thing that I cannot emphasize more. As somebody who's been in this program seems like forever. One day I will graduate. Your biggest support system, besides you have your cohorts, which you guys really do need each other, so don't ever forget that, because that's so important. But these guys, the faculty, are absolutely amazing. And sorry. Sorry. But this is a small class. I mean, look around. We've got a small college. And if anybody asks me, what is the biggest benefit going to Davenport as a nursing student? It's the fact that you really get to know your cohorts and you really get to know your teachers. And they will fight for you to help, sorry, make sure you get through it. So every single one of you guys have been advocates for me. And this is my new, that was my old senior class, this is my new senior class. And, you know, I was recycled. And I remember thinking, I was so worried that I wasn't, you know, gonna fit in, because these guys are so much younger than me, and it's just a different vibe. But it was just as wonderful. They took me in. But that's what I mean. Your cohort is a huge part of getting through this, and you're gonna make friends in nursing school that you're gonna have for the rest of your life, because the goal is still the same. We're all different, but the goal is still the same. So it's.
Somebody what was it? I have a comment. No, but for juniors and seniors, or for juniors and sophomores, another thing I had to realize was that I had to start thinking like a nurse in order to accept my role as a student nurse. A lot of you guys might already be in healthcare. I'm on the other side of medicine. I'm a pharmacy technician, so I don't have like the hands-on, like the nurse A's and the med techs and all that. But if you start thinking like a nurse, start with the critical thinking, the ad pie, you'll hear that a lot, and start really just putting your mindset into, okay, I'm a nurse. This is what I'm supposed to do as a nurse, not I'm a nurse technician. What should I do? Or I'm a pharmacy technician, what should I do? I'm a medical assistant, what should I do? You got to start thinking like a nurse if you want to get to this side of the room.
Don't be scared though. You'll be okay. You'll find people that, like she said, they become your family. Like, you tell them things and you're like, they know you. All of you. And I mean, I've kept in contact, too much sometimes, with people throughout the summer, and these are your encouragers, because you have your family, you have your community, but they still don't know exactly what you're going through. So the stress, cry with them. I mean, cry. Sometimes just let it out and then pick yourself back up. But you'll find people to support you and you'll be okay, I promise you. And you can always, if you know people in the class or the grade above you, reach out to them, get tips from them. SNA is a great way to get involved too, because people can help you and they can give you study tips and kind of point you in the right direction. And like she said, the faculty, amazing. You will love them.
When you said get to know your classmates, I think of Carla, because it was, I think, the final exam, and somebody was late, and I'm like, oh, I don't know where they are. And she said, maybe they're stress pooping. I'm like,
Any more questions? What advice do you have for reading questions and knowing what they want?
You can say I don't know, it's okay.
Every question, which orange is the most orange? They're probably all right. What I do, I think we talked about it earlier, is underline keywords, cross out, this doesn't make sense, or if it's numbers that don't really mean anything, they'll give you a full set of vitals, but it's asking you about just the blood pressure. Scratch out the stuff that doesn't matter. And then underline not, or needs further education. That's a big one. Select all that apply. You could always ask your professor, hey, how many of these are actually right? That's a good one. Really break down that question, find out what it's asking you, because sometimes that can make a couple of those oranges look like apples. This isn't right. Oh yeah, and ABCs, you'll learn that.
Airway, it's airway.
Felicia, did you have a lot of select all that apply
Always
on your
airway.
NCLEX?
I had 6.
6. Okay. That's good.
I had more than 6.
I had 5 math, which nobody in your class did. No, my test was so
I had no math. I am jealous.
stupid easy. I walked out like, oh my god, I definitely failed because that was too hard. I took it in 30 minutes. I got to question 75 and it went to question 76, so I had to get up and walk away. I cried, receive it, came back in, answered 76, and was done.
Yeah, you were very well prepared. I mean,
I
that's
was.
instrumental to.
But once I hit that 75 and it kept going, I'm like, oh my god, I can't do this. So yeah, I went and cried in the bathroom for 3 minutes. But I sat back down and answered one more question.
Our class is going to be different because now they're changing it, so.
Some of us can have no right answers.
Yeah, no, I didn't have many select all of my and I had 5 I got up.
I had a lot. It's irrelevant.
We also found out the same day if we passed.
I did not. So if you do, that's a love-hate right there. If I do say
I took
so
it
myself.
at like 8:30 in the morning and I knew at 4:06 that I
I waited 3 days. It's horrible.
because I drank very heavily.
All the while.
All right, let's thank the panel. We are really moving along well, so thank you for your participation and your patience with all the guest speakers. So we are going to go ahead and do our breakout sessions. One thing that I did want to talk about just real quick is somebody talked about HESI, ATI, so on and so forth. So ATI is the resource that you needed to use when you took your TEAS test. So that username and password needs to be really prominent in your mind. If you don't know it, make sure that you go back and learn that because we are no longer using HESI for assessment and evaluation. We'll be using ATI. Not to panic, we feel like we have great products for all of you. So when you signed up for your TEAS test, you needed a username and password. Go back and search that into your search engine, get familiar with that. If not, we can get you re-registered. But that will be the resource that we're going to be using. So for our breakout sessions, we'd like the seniors to stay here, please. Juniors are going to go to Sneeden 2 and 3. So if you go out these back doors and keep on walking straight, those will be those rooms. And then sophomores, we're going to go down to room 015, and Margaret and Julie will meet you down there. The SNA meeting is going to be in the Sneeden rooms 2 and 3 at 11:30.